Okay, everyone. I forgot to talk about the humerus. So I'm going to talk about the humerus and then some forearm muscles. Okay, so get a review. There we go. Okay, here we have the humerus, and that's your arm bone. Okay, so it's like this, right? And if you notice, there's going to be, so I can get close. There, yep, you can see them. There's two bumps. There's going to be a big one, which is here, and a smaller one, which is there. Okay, so the bigger bump, I'm going to call that the greater tubercle. Smaller bump, lesser tubercle. Here's the head of the humerus, which fits into that glenoid fossa, right, of the scapula. So greater tubercle, lesser tubercle. A little further down, two bumps, right? We're going to have an epicondyle here and here. This one is going to be the medial epicondyle. See, look. Okay, medial epicondyle, lateral epicondyle. Here, we're going to have this bare area right here. We're going to call that the trochlea. That's where right here, yeah. That's where the trochlea of the ulna connects. And over here, I'm going to call that the capitulum. I didn't talk about the capitulum and the radial head in the other video, but I did mention something called the annular ligament, and that attaches from the capitulum of the humerus to the head of the radius. And it's important to know, because I think I did mention this, that if you're walking across the street with a child and they're not going as fast as you want them to, so you reach out, you grab their arm, you lift them up, you bring them across, that could tear that annular ligament, which connects the capitulum of the humerus to the head of the radius. Okay. All right, so let's go back to this again. We're going to talk about some muscles. All right, so medial, because the head of the humerus is medial. Has to be, right? Can't make it go like this. If you do, you're in a world of hurt. So we have humeral head. So we know here's the medial epicondyle, and you can feel that on yourself. I don't know if I can get it, but in your elbow, there's a bump that sticks on the medial side. And then there's one on the lateral side. We'll call that the lateral epicondyle. They're kind of important because on the medial epicondyle, that's the common origination point of the forearm flexors. Medial epicondyle. Lateral epicondyle is the common origination point of the forearm extensors, which are on this side. Okay, flexors here, extensors here. Okay, so what I want you to do is with your other hand, take and put your thumb on your medial epicondyle and run your fingers down your arm, like, I can't get the camera to look at it, down like this. So thumb on medial epicondyle, fingers down your arm. Okay? Then we're going to talk about, keep them there, then we're going to talk about something called, I'm sure you've heard of it, pass-fail, pass-fail. All right? Let's put this arm together here. Okay, so keep your fingers that way. All right? Fingers still that way? Good. Just watch the video. Don't press anything. All right. Here we have, let me get it up there, 4 muscles. 1, 2, 3, 4, just like on your fingers. Okay? Pass, fail, pass, fail. First is P. That's going to be, so your index finger is going to be your pronator teres. Your middle finger going down your arm, that shows you where the F, or the flexor carpi radialis muscle is. Your ring finger is going to denote where the palmaris longus muscle is, and your pinky is going to be denoting where the flexor carpi ulnaris is. Okay, so PF, PF. Those are the 4 superficial forearm muscles. Okay, let's talk about those a little bit before the next video. What I like you to do is go like this. Take your pinky and your thumb, and put them together like that, and just kind of push hard. Okay, you should see right in here a muscle pop up. Sometimes you can make it go like, if you do a fist really hard, but you push your thumb and your pinky together, there's going to be a muscle that pops up. Okay, if you can see that, I don't know if you can or not, I can't tell. All right, but on yourself, you'll see it pop up. Now, that muscle is this one here called the palmaris longus. And the reason why it pops up, see this white band? Okay, that white band is called the flexor retinaculum. We're on the flexor side, okay, and that's called the flexor retinaculum. There's one on the extensor side too, white band, but we're dealing with the flexor side, so flexor retinaculum. Look what the palmaris longus does. It goes superficial to the flexor retinaculum. That's why when you do this, it sticks up because nothing's holding it down. Whereas the flexor retinaculum is holding those other tendons. Flexor retinaculum is holding those other tendons down and it's not popping up. So palmaris longus. Okay? And those are some of the forearm flexors. We're going to go into the others. How much time did I put in this video? Yeah, we'll go into those others in the next video. Okay.